All right, welcome back. It's time for our Vidant Spotlight. And in the spotlight today, Dr. Donald Price, who is the Division Chief of Neurology for the ECU School of Medicine, which we'll get him to explain how he interacts also with all the inpatient services at Vidant Medical Center here. And Jordan Sheets, who was here a year ago. She had a different name a year ago.
Yes.
What was your name last year?
Jordan Joyner.
So you got married.
I did
Congratulations.
2 months ago.
Congratulations. Jordan is the stroke nurse navigator at Vidant Health. Yes. Good morning to both.
Good morning.
How are you? It is stroke month, Dr. Price, and we hear often enough that we live in the stroke belt. Is it getting any better?
It is getting better. So actually stroke has, we have new interventions available, and through control of some of the risk factors for stroke, we're diminishing the number, stroke as a source of mortality.
Mm-hmm. How do we diminish our chances of stroke? Lay off the sausage?
Excellent question. So the preventative things that you can do, the first thing is blood pressure. So seeing your primary physician and getting your blood pressure under control. That's the first thing.
And knowing your blood pressure. A lot of people don't ever get it taken, right?
Right. No, you have to. So you can do that through a screening, but to get it treated, you're going to have to see your primary physician.
Yeah.
The other thing is to identify whether you have diabetes. A lot of diabetes doesn't go recognized until it presents with some complication. So I think recognizing and treating diabetes, high cholesterol, smoking cessation. We lecture to our patients about that all the time, but not smoking, diet, and also exercise. Those are all things that can decrease your risk of a stroke.
All right, and now we do have some incredible services here in Greenville and throughout the Vidant Health Network for people who do have stroke. Let's talk to Jordan, who is the stroke nurse navigator. Well, first of all, I want to say I actually was over at the Heart Center this past weekend visiting a friend who was in the hospital, and every time I go into the Vidant Heart Center, I'm just blown away at, number one, how nice it is, and number two, the services that we have available. It doesn't look like your average hospital when you go in there anymore, does it?
No, that's very
It's
true.
something else. But tell us what you do as the stroke nurse navigator. What's your job?
So my role is kind of unique. It's the first in its kind, and it's the first at Vidant, but it really is a role that I do all of the community screening and outreach and prevention for stroke, but I also, in the inpatient side, see patients and families. I try to see them from the start of their hospital stay and follow them throughout the care continuum. So being a resource for patients and families with education and identifying what their barriers are at time of discharge and trying to work through those on the front end so that we're not trying to handle problems after the patients have already left the hospital. And then I also do our stroke support group at the hospital and really just trying to serve our patients and families during a really difficult time.
As I mentioned at the outset, this is Stroke Month, National Stroke Month. Do you have anything special going on this month you want to talk about?
Well, I do. We were just talking about prevention for stroke and knowing those risk factors. And this coming Saturday at 3rd Street Community Center, we're actually going to be doing a stroke screening. It'll start at 9 a.m. in the morning, and we'll go through cholesterol levels, blood pressure, and your glucose levels, and really just counsel you on some of those things that are too high, or and try to help you get plugged in with some resources. So like Dr. Price said, one of the best things is having a primary care doctor that you see on a regular basis that can trend and monitor those things.
Dr. Price, is the major problem that you see, of course I know as we age, the chances for all health problems increase.
Absolutely.
But is there anything that you see that, particularly here in Eastern North Carolina, again, we've talked about loving barbecue here. We talk about, our eating habits. We've been talking about food all morning on the show.
Right.
I mean, so give us the straight poop on that. How risky is it?
In terms of diet?
Yeah.
Well, I think tobacco usage is a big thing. That is something that when you see stroke in a younger person, there's often convergence of several vascular risk factors. So the diet, tobacco usage, and high blood pressure,
Yeah.
and unrecognized diabetes.
And so eating anything in moderation, I guess. So if we all go to the big barbecue festival in Aden this weekend, just eat very moderately, right?
No, that's correct. You know, a well-balanced diet, and you know, diminishing. Well, knowing your cholesterol numbers is important too.
Yeah.
So
So cholesterol is as big a factor in stroke as blood pressure?
it not quite as high on the rank order list,
Right.
But it's definitely up there.
Yeah.
Yes,
Have the blood pressure medicines gotten better over the years?
in terms of better to easier to tolerate.
In terms of controlling people's blood pressure, because I know there are a lot of side effects also with blood pressure, but
Yeah, no,
blood
that-
pressure medicines.
Yeah, absolutely. You know, there's a lot of different options available, and you know, I think that the biggest problem with blood pressure medicines is remembering to take them. So most people don't have a lot of side effects from the blood pressure medicines themselves. So,
Yeah, yeah. All right, so Vidant Health, and you know, again, this Nurse Navigator thing that was started. I remember years ago when the Nurse Navigator program was started. That's quite
And
a
the cancer,
it's a resource that you just don't find everywhere, and so it's a pretty neat thing for you, because your job is to interact with the families and help them get through the process.
Yes. Yes.
It's kind of like a stroke concierge, actually.
Yeah.
So no, I'm serious. It helps to efficiently convey a patient from their arrival through their discharge,
right.
And I think it works very well.
Navigator is probably the right term, right?
Correct. It's you know, the healthcare system is quite complicated, so having someone to help navigate through that is it's really important.
And I would imagine you become quite a resource for families, and they, with your personality, I'm sure you do a great job with it. But they probably end up counting on you for a lot of things.
They do. They do.
Yeah,
Yes.
yeah,
So
yeah.
when I leave here today, we'll get back to the office and see who we need to talk to and what we
Yeah,
need to get done.
That's great.
Yeah.
Dr. Price, anything else that we've missed that you want to mention?
Well, a couple things. You know, stroke recognition. So a lot of our patients, you know, one of the problems that we have is
Yeah.
people don't go to the emergency room when they've had a stroke. I think a lot of times that's because strokes are not painful. You know, they'll present with symptoms that people hope will go away after a night's sleep, but they don't.
Like,
That-
what are they?
So examples would be weakness on one side of the body, numbness on one side of the body, loss of vision, severe headache, change in speech or your cognition. Those could all be presenting signs of a blocked blood vessel to your brain. And we're recommending that people call EMS, because if you get there quickly, and you're, you know, in the emergency room has protocols to get people through the system very rapidly. So you'll never be seen quicker in the emergency room than if you present with a stroke. But there are new therapies that are available to open up that blocked vessel. There's some chemical sort of Roto-Rooter types of therapies that are available, and now we actually have mechanical ways of going and removing a clot, provided a person presents within less than 6 hours. And those therapies are dramatic, and
Is that fairly new?
that is new, yes,
Yeah.
within the past few years. And you know, we're kind of following the cardiologists along those lines. The cardiologists have been doing a lot of this for the heart for a long time. The brain is a much more sensitive organ, and so we needed to develop better instrumentation, which has now occurred. And so we're having a lot of success with clot extraction and the chemical lysis, breaking up of clots to the brain, and people have better outcomes, shorter rehab stays. So we're really trying to push the initiative for people when they're having a stroke, get to the hospital quickly, and the fastest way to get there is call 911.
Yeah, a lot of people just want to say, well, I'm not in any pain, we'll just drive over there. But what ends up happening when you walk in, you might not get seen as quickly as if you come in on that ambulance, right?
Absolutely.
Right.
Yeah, right. Interesting. And again, the main symptoms that you would be experiencing are?
Weakness on one side, numbness on one side, alteration in vision, double vision, change in speech, change in cognition. But there's actually an acronym, and Jordan, do you want to just mention
So
that?
the word FAST is a really easy way to remember it. F stands for facial droop. So if one side of the face is drooping, or you ask the person to smile and it's twisted. A is for arms. Ask the person to hold both arms out straight in front of them. I would demonstrate, but I'm afraid I'll knock the mic over. Ask the person to hold both arms straight out in front of them, and one of them will either fall down, or it'll drift, or it'll be over to the side. And then S is for speech. So is their speech slurred? Are they able to speak? And then T is for time, and that's that call 911. So
That's good. FAST. FAST.
Yes.
And is it true that you said numbness or loss of use of one side? Is it usually the left side, or can it be the right side as well?
So it just depends on, your brain is crossed. So the
Right.
right side of your brain controls the left side of your body. The left side of your brain controls the right side of your body. So if one hemisphere is involved, it'll involve the opposite
So it
side.
can be your right side. A lot of people think that if it's on your right, well, if I'm feeling something on my right side, that's not a stroke.
No, so no, that's not correct. There are certain types of things, like if you have an alteration in language, that tends to be on the left side of the brain.
Yes.
And if you have an alteration in your visual spatial skills, that's usually the right side of your brain. So there are things that are lateralized to left and right, but
interesting.
your motor function, that is
Gotcha.
the strength,
Gotcha.
can come on either side.
Is there a website or information available that people can find? Can you give some information on how people can get more information about this?
sure, you can go on our Vidant Health website, and if you just type in stroke into that search bar, it'll pull you up to some of the resources that we have. You can also go to the American Heart Association. It's also the American Stroke Association, or the National Stroke Association. So if you type any of those into your Google search bar, you'll be able to come up with a lot of resources, especially if you know someone that's had a stroke, or your family member. Going to that Vidant Health website and finding that stroke support group that we have. Everyone's welcome to come to that.
All right, great. Thank you both for coming.
No,
Great
thank you for
information.
having us.
Thank you.
Jordan Sheets, the stroke nurse navigator for Vidant Health, and Dr. Donald Price, division chief of neurology for the ECU School of Medicine. And I was going to ask you, when we say ECU School of Medicine, all the inpatient services are done at Vidant Health.
That's correct.
Right,
Yes.
that's-
We have an outpatient clinic, but our inpatient service is predominantly stroke.
Yeah.
And we do that through Vidant Health. That's
Right.
correct.
All right, good. Thank you both for being here.
Yes,
Thank
thank
you.
you.